people start to realize our differences aren't as big as they seem.
I couldn't really understand the magnitude of what was going on.
I know a lot of people were affected.
You know, it's still that divide.
From the All Indiana Podcast Network and Wish TV, this is Our City, Our Voice.
You look a lot different at it.
Everybody was kind of spinning about what it was and what was happening.
Everything's changed.
Everything's changed.
What can 160 years of experience teach you about the future? A lot, especially when it comes to protecting what matters. At Pacific Life, we've helped people and businesses confidently embrace the future with life insurance, retirement income, and employee benefits. With strategies built on strength and trust, and a promise to be here for you today and tomorrow. Ask a financial professional how Pacific Life can help you today. Pacific Life Insurance Company, Omaha, Nebraska, and in New York. Pacific Life and Annuity, Phoenix, Arizona.
Time for our morning checkup. No time in the waiting room even, as we welcome in Wish TV medical expert, former Surgeon General, Dr. Jerome Adams. Dr. Adams, good morning. Good to see you, sir. Big news about sickle cell disease, the debilitating blood disorder. FDA has given first approval to a gene therapy for it. What do we know about it, how it works, and why this is different?
Well, good morning, and I'm glad to be here because I'm really excited about this. And I'm excited because sickle cell disease is a group of rare blood disorders that impacts about 100,000 people in the United States, most of whom are Black. Sickle cell carriers have a mutation in hemoglobin, which is a protein in red blood cells that carries oxygen around our body. These red blood cells have a mutation that causes them to go into a sickle shape that clogs up the blood vessels. And as you mentioned, this can cause debilitating pain. I mean, literally crippling pain. People with sickle cell are frequently in the hospital, and they often, unfortunately, die prematurely. So last week, the FDA approved 2 new medications that have been shown to dramatically reduce symptoms and have the potential to one day offer a cure. Both of those treatments work by genetically modifying patient stem cells.
What are unknowns still, since this is early? I mean, FDA, okay, is a big thing, but are there still unknowns, long-term effects, things like that?
Well, here's what we know. 29 out of 31 patients in one study had no sickling events a year out. And when you talk to people who were in the study, they will tell you they would do it over and over and over again because this disease is so debilitating. But there are potential side effects. Treatment is a painful process that kills abnormal blood marrow. They essentially have to give you chemotherapy to kill the bad cells in your body and then replace them with the genetically modified new cells. And so that's a problem. It can cause immune issues. Also, it's been shown that people may end up developing cancers down the road. But as I mentioned, people with sickle cell will tell you they will take that chance all day for the opportunity no longer to have sickle crises.
And as you well know, many people know whether they have it. Some have the genetic trait for it. If someone's watching you right now and says, do I need to talk to my doc about this? What would you say?
Well, everyone gets tested for sickle cell disease when they're born. So people typically know if they have sickle cell trait, and you certainly know if you have sickle cell disease. If you're someone who's in this situation, talk to your doctor. You can go to the Martin Center here in Indianapolis. You can go to their website, martincenter.org. Because the most important thing is that people who have sickle cell disease aren't even getting the treatments that are already available out there in most cases. So we want them to know about these new treatments, but we want them to get optimally treated based on what's already available.
A quick shift to another topic because it's also catching our attention. A new study that shows NCAA athletes report fewer mental health concerns than they did at the peak of the pandemic. Your thoughts on the study and whether there's anything for the rest of us to learn through how schools and athletes have dealt with all this?
Well, we know that the pandemic shutdowns absolutely impacted young people's mental health, the isolation, the loneliness. And this is promising because it tells us that young people can recover if we get them back involved in school and sports and activities. So if you're a parent out there, the most important thing I would say is to make sure your child's involved in something, that they're getting the opportunity to be around other people. And if we do that, then we will be able to overcome this deficit, this debt that we've accumulated over the past 4 years.
Important insight in our morning checkup from Dr. Jerome Adams.
Discover more at wishtv.com. And when you follow Wish TV on Facebook, check out more podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.